My name is Natalie Mera, and I'm the Executive Director of the Ontario Health Coalition. We're here today because the revelations that former Health Minister Christine Elliott has now moved over to become a lobbyist for Clearpoint, the company that owns the private hospital Don Mills Surgical Unit, raises serious questions about ethics and transparency and integrity in government. We looked more deeply into what's happened at Don Mills Surgical, and our questions have only deepened. It turns out that during Minister Elliott's tenure as the minister, the size of Don Mills Surgical actually increased substantially. The funding increased by 278% in the years of fiscal years 2017-18 to 2021-22, the years in which Christine Elliott was minister. And that extraordinary increase in funding is not matched in increases in funding to any other hospital, public or private, in the province. And despite legislation forbidding the expansion of private hospitals in Ontario, Don Mills Surgical received a very, very significant expansion that required ministerial sign-off. It required the sign-off of the minister. We also looked into the integrity rules for ministers and found that Miss Christine Elliott moving from being the minister who undertook these measures for Don Mills Surgical over to being a lobbyist would be unlawful under that act. So I'll just run through the facts as we know them. We found that Don Mills Surgical Unit, now owned by Clearpoint, was expanded from 3 operating rooms in 2019 and mainly an outpatient surgery unit into a 20-bed inpatient unit hospital with 6 operating rooms and 7 recovery bays. This, despite the fact that the Private Hospitals Act, which was brought in 1971 to ban future private for-profit hospitals in Ontario, and forbids expressly expanding the bed capacity of any private hospitals in Ontario, also bans expanding the number of patients that those hospitals served. And so therefore, any expansion of Don Mills Surgical is clearly unlawful under the Private Hospitals Act that expressly bans that. So it's not like a government can get around the ban on private hospitals by doubling the size of a private hospital. They aren't allowed to expand them, and they're not allowed to open new ones. But that happened. In the Act, it requires an express ministerial written approval prior to any alteration or renovation or sale, transfer of a license, move, etc., of a private for-profit hospital. All of those things require expressly the minister in writing to approve. So any claim that the minister had nothing to do with it cannot be true. A recent report from the Canadian Centre for Policy Alternatives, which relied on Freedom of Information requests to find that Don Mills Surgical received a 278% funding increase between 2017-18, the year that the Ford government got elected, and 2021-22. Christine Elliott was health minister from 2018 to 2022. An investigative report by CBC found that Don Mills Surgical, aka Clearpoint, was being paid more than double for surgeries than public hospitals. For example, for cataract surgery, Don Mills is getting $1,264. Public hospitals are getting $508. For knee arthroscopies, Don Mills Surgical is being paid $4,037 for the equivalent surgery that public hospitals are getting $1,692. In all of those cases, they're getting more than double the funding that public hospitals are getting for surgeries. In the lead into the last election, we warned in press conferences across the province that the government was expanding the private hospitals and private clinics. They expressly denied that. In fact, the ministry spokesperson told the media, quote, "These claims are categorically false. To be clear, the government is committed to supporting the province's public health system. The use or function of private hospitals and independent health facilities in Ontario is not being expanded or changed." They said that multiple times in multiple communities. We've provided the links in the media release, and that was an outright lie. At that time, they had already expanded Don Mills Surgical dramatically. And finally, subsection 18, sub 4 of the Ontario Members' Integrity Act prohibits former cabinet ministers from ever making representations to the provincial government in relation to a transaction or negotiation that the minister was substantially involved in as a member of cabinet, if that representation could result in a specific benefit for a person or entity. That section says that it is an offense to violate, section 18.5 says it's an offense to violate that section, and it's punishable by a fine up to $50,000. We are now calling on the Integrity Commissioner to investigate how the minister was able to go from giving extraordinary funding increases, 278%, nowhere in the realm of what any other hospital got in Ontario, expanding the scale and capacity of a private hospital in violation of the Act, paying double the cost per surgery to that private hospital compared to public hospitals, and then after leaving office, go over and lobby for the owning company of that private hospital to lobby to expand that hospital further. Bottom line, it reeks. It reeks, and it is not acceptable. Neither is a good public policy, but also it raises very serious questions about integrity and ethics in government, about conflict of interest and corruption that must be answered by this government. And I'm joined today by Duff Conacher, who is the co-founder of Democracy Watch. He also has a doctorate in law and is an expert on integrity, ethics, and democracy. Duff Conacher.
Thank you very much, Natalie. As Natalie mentioned, I am co-founder of Democracy Watch and did my PhD in law looking at best practices in political finance, government ethics, and also lobbying. For the past 7 years, Integrity Commissioner J. David Wake has essentially refused to enforce the clear rule in Section 3.4 of the Lobbyist Registration Act that prohibits a lobbyist from placing a public office holder in a real or potential conflict of interest. He has let dozens of lobbyists, former campaign staff for Premier Ford and the PC Party, former ministerial staff, and in this case of Christine Elliott, a former minister, essentially violate this section of the Lobbyist Registration Act and allowed them to lobby when there clearly is still a conflict of interest based on the past favors, work, and relationships that they have with Ford cabinet ministers. And as a result, he is allowing these dozens of former PC Party Ford campaigners, ministerial staff, essentially do unethical lobbying and corrupt Ontario government policy-making processes. Democracy Watch has filed several lawsuits challenging these rulings by the Integrity Commissioner allowing this unethical lobbying. And we are currently at the Ontario Court of Appeal with those lawsuits. There'll be a hearing next April. But Integrity Commissioner Wake could do the right thing now and say he was wrong, that a conflict of interest does not disappear 1 year later, not after you've worked for years with cabinet colleagues, not after you've helped fundraise or campaign and help the Ford, Premier Ford, the PC Party, cabinet ministers win elections or worked with them, that the conflict of interest doesn't disappear after 1 year. You've done favors for them. They owe you when you've helped to win an election for the rest of their career. And he could reverse his interpretation right now of this provision, Section 3.4 of the Lobbyist Registration Act, and stop all of this very smelly, unethical lobbying that has been going on since the 2018 election, when he first started allowing lobbyists to go through the revolving door from a campaign war room or minister's office and out into lobbying soon afterwards the people that they had helped get elected or had helped as staff people. So he shouldn't wait till the courts reject his bizarre interpretation that somehow claims that these conflicts of interest magically disappear after 12 months and start enforcing this rule properly, which would stop dozens of people from lobbying and corrupting Ontario government policymaking processes, and also stop Christine Elliott from being a lobbyist for a company that she oversaw as health minister. The Integrity Commissioner should do this, should investigate the situation. As well, I think the Auditor General should be looking at this spending because it certainly doesn't seem to be value for money. And as Natalie mentioned, subsection 18.4 of the Members' Integrity Act says that a former minister can never do representations to the government if it could result in a benefit for an entity that the minister was substantially involved in terms of transactions or negotiations in the past. It's difficult to believe that as Health Minister Christine Elliott was not involved in decisions to increase the funding for these private hospitals, and a full investigation is needed. It isn't an offense, as Natalie mentioned, and so a full investigation by the proper authorities is needed with regard to that particular legal provision. Welcome any questions that you have.
Thank you, Duff. Okay, any questions? That's it. Okay, thank you very much. Thanks for coming.